So Tony, we're here. We've got the RST behind us, or the Reactive Step Trainer. It's Biodex Rehab's newest product that was launched in early 2024. And one thing that we really appreciate about your model and the way you approach business is through these continuity programs. Maybe you can help shed some light for us. Maybe there's a paradigm shift occurring, or what are you seeing that physical therapists can gain with using continuity programs?
So for perspective, like going back, I opened the first Total Therapy Solutions clinic in 2002 down in Sarasota, Florida. I remember back in 2002, therapists that had been practicing for 20 years already back then were complaining because they used to receive $300 an hour or per visit in reimbursement, and now they were only receiving $180 per visit. I thought that was amazing. Like coming in 2002, I was like, are you kidding? I was a personal trainer getting $30.
Yeah.
So, right now, 2024, moving into 25, insurance continues to decline. Our average, when you look at our numbers and publicly traded numbers, the average reimbursement per visit is anywhere between $72 to $95. Medicare reimbursement, especially if you account for multiple payment procedure reduction, everybody is going down. So we've always had what we call a wellness program. We changed the name to a non-covered maintenance program. The intent behind that is patient would come in, Medicare referral or other. We'd provide a plan of care. We'd meet the goals, but that patient had carved 2 or 3 hours a week just to focus on fitness. And we didn't want them going back to their house and filling that time with soap operas or something else. So we're like, look, you're already here. Just keep coming. Keep coming. We're not going to make a lot of money on it. We used to charge $30 a month. Now we charge $100 a month. But the idea is continuity has always been part of what we've done. It's a way to offset declining reimbursement. And then when I look at something like the RST, the Reactive Step Trainer, I'm like, even better. I had to create a continuity program that was safe for a patient to do independently, but we never really could do anything related to balance or anything that had a risk of falling, because obviously I couldn't put a therapist with that patient. Now we've got the harness, we've got the system that tracks, how many minutes they did, how many steps they took, what their stride length was, all of this objective data. Every time they come in, we set a profile up in the computer system. It tracks all of that under their name so they can get a printout with it. And basically what we're doing is now we're going from $100 a month to $500 a month. We're targeting individuals that they know that they need to improve their balance. They're having challenges. Some of them are falling once or twice a month at home. Maybe it's a neurologic condition, maybe it's an orthopedic condition. But the idea is this allows us to improve that continuity. So now instead of waiting for discharge, we get the referral right from the evaluation. First day they're in the clinic, we get on, we use the machine so they start to become familiar with it. And then as you guys know watching, Medicare and other third-party payers will say, look, once somebody becomes independent with something, it's no longer a covered service. So once somebody gets on a bike, I set them up, I program it, I show them how to work it, it's done. It's not a covered service anymore. But if I want them to do balance and I don't have clinicians that could be with them if it's not reimbursed, it's a self-pay service, this is where I think that kind of marriage between, hey, we need you to do hard things, this allows you to do hard things safely, and this is not paid for by insurance once you've met that threshold. So now you can pay out of pocket. I would think, right now, if I run quick numbers in my head, we probably have 10 to 12 people that are doing this self-pay program. They're coming in twice a week. They do have scheduled appointments so that we don't bombard the clinic because everybody wants to come Monday, Wednesday, Friday at 10. And it gives them that opportunity to not lose the gains they made in traditional Medicare covered physical therapy. But the other part of this, which I haven't given you a chance to ask, everybody's going to have a problem down the road. Yeah. So even if they came in for regular therapy, then they do the continuity program, 3 months, 6 months, 9 months later, they're like, man, my shoulder hurts. They're already coming twice a week. So now we reactivate them as a shoulder referral develop a shoulder plan of care. They can keep working on balance coordination, lower extremity endurance, but we didn't have to like try and go out and get a new person. That person was in the system already.
Sure, excellent, excellent. Now, kind of one topic I know you're a big proponent of is the RTM. Right? Now, how do you see our Biodex Rehab's reactive step trainer fitting into that model?
Yeah, I love this question. Most therapists, and I think people, anybody watching this, they're thinking of RTM in a particular way. They're thinking, well, RTM is for remote therapeutic monitoring. It's the patients at home, they're doing their own program. What I have found is they don't have to be at home. So when they come in here, they can give me objective measurements about their stride length. We can talk about cadence, we can talk about speed, we can talk about duration, we can talk about distance. Any of those objective measures can be relayed through the RTM platform back to us. And RTM is a billable service. So since I think it's 2022, therapists are able to bill Medicare and other third-party payers for RTM. Typically, here in Ohio, Medicare coverage for RTM reimburses about $140 per month. Okay. So you start stacking. You say, okay, $140 for the RTM per month, $100 minimum out of pocket for access to the facility and using the machine twice a week. If I did do a physical therapy evaluation here in Ohio, it's $98 Medicare reimbursement. So all of a sudden, you see the added revenue comes in. It's what we need to make up for what we're losing on the conventional care third-party reimbursement side.